Unfortunately, many mental illnesses are still a taboo and often remain unclear. Borderline, also known as emotionally unstable personality, is a good example. It's a complex mental disorder which influences how people see themselves and how they interact with the world around them. It can be hard to diagnose because the symptoms overlap or closely resemble other psychiatric problems. So, who are the borderline people one meets in everyday life? Maybe you had a girlfriend from school. Because of a minor argument, she accused you of betrayal and said that you were never really her friend. After a few weeks or months, she calls you as if nothing happened between you two. Or maybe you recognize your colleague who praises your efforts in performing a minor task. However, another day he scolds you for a minor mistake. Sometimes he is reserved and aloof, but the other day he seems to have been replaced. He turns into a loud extrovert. Or your ex-girlfriend who changes her style and behavior every week. One day she looks like a pop diva and the next time she looks like a punk. She can't end a relationship out of nowhere, only to return a few hours later promising endless love. Or maybe it's your neighbor who can't cope with his unstable marriage. He denies his wife's apparent infidelity and the next day takes all the blame for the failed relationship. His feelings range from guilt and self-loathing to furious attacks on his wife and children, who, he says, are unfair to him. Anyway, there is a good chance that the description of these people may sound familiar to you. Maybe you have already heard something about this personality disorder or recognize some characteristics in yourself. All these people have one thing in common. They are inconsistent, unpredictable, and unstable in their thinking, feeling, and acting. The common image of people with borderline personality disorder is therefore mostly negative. But that instability and impulsiveness often stem from vulnerability and damage. Borderline symptoms are often present during adolescence. In this phase of life, major changes take place in relationships, work, and other areas of life. Prevalence of the population is an estimate of 2–6%. Until recently, it was believed that women with borderline personality disorder outnumber men by 3 to 4 times. But more recent epidemiological studies confirm that the prevalence is the same for both sexes, although women are more likely to seek psychological help. In addition, symptom severity and disability are greater in women. Numerous scientific studies have linked borderline to anorexia, bulimia, ADHD, drug addiction, and teen suicide. Some studies have shown that nearly half of all hospitalized patients with eating disorders have a borderline disorder as well. And more than 50% of substance abusers also meet criteria for this personality disorder. The main causes of this disorder are childhood traumas such as psychological, physical, sexual abuse, neglect, or even a divorce of parents. High-risk groups are children of alcoholics, parents suffering from depression, narcissistic and borderline parents, emotionally unavailable parents. As a result, a child is unable to bond securely with their caregivers. A toxic family environment negatively influences the development of a child's brain. Children internalize the instability, loneliness, and pain of their childhood, but genetics can also contribute to the development of borderline. Underlying vulnerabilities like impulsivity, tendency to intense emotions, and mood swings can be genetic. This has to do with the processing of stimuli in the brain. first-degree relatives of people with this disorder are 5 times more likely to have the disorder than the general population. But scientists haven't found a specific gene yet related to the development of borderline. The Manual of Psychiatric Disorders, the DSM-5, lists 9 characteristics of borderline. To get a diagnosis of borderline, a person must meet 5 of these criteria. The life of people with borderline personality disorder can be described as a non-stop emotional roller coaster. Just as a child, one moment they may feel happy and the next despondent. Little things that other people brush off can send them into an emotional storm. Brain images show that intense emotions in people with borderline are less well regulated by the prefrontal cortex of the brain. It is as if they lack the natural brake. That would explain why people with borderline can become unreasonably angry from one moment to the next, or become intensely emotional about a certain event. These mood swings are intense, but they tend to pass quickly within a few minutes or hours. People usually have no idea why this is happening to them, and this misunderstanding can lead to even greater self-loathing and even deeper depression. An important feature of borderline personality disorder is the absence of a core sense of identity. When describing themselves, people usually paint a confused or contradictory self-portrait. They don't know who they really are. As a result, they often change jobs, friends, partners, goals, values, or even religion. Sometimes they feel good about themselves, but other times they hate themselves. To overcome this vague and mostly negative self-image, they, like actors, are constantly on the lookout for good roles that they can use to fill the emptiness of their identity. Therefore, they try like chameleons to adapt to the environment, situation, or people. People with borderline personality disorder are regularly experience chronic emptiness, as if there is a hole inside them. They may even feel like nothing or nobody. They are looking for relationships and impulses from the outside to fill this emptiness. And it's actually a terribly exhausting feeling. It drives them to self-destructive actions, such as the use of drugs and alcohol, overeating or starvation, uncontrolled shopping, gambling, risky sexual behavior, and self-harm. But nothing feels truly satisfying. They may even attempt suicide, and this often happens not with the intention of dying, but to feel at least something. All these attempts are to escape from their emptiness and unbearable emotions. The world of an adult with borderline, like the world of a child, is divided into wonderful people and evil people. They're intolerant of human inconsistency and ambiguity. There is no middle ground for them. They hardly perceive nuances and shades. Because of that, one day they can adore a person, and the next completely devalue and throw him or her out of their lives. This type of behavior is called splitting. It's one of the main defense mechanisms that a person uses. Splitting is a rigid separation of positive and negative thoughts and feelings about oneself and others, unlike other people who can perceive and experience 2 conflicting feelings at the same time. For example, a person with a personality disorder can perceive the same person in his environment as 2 separate people at different times. A person admires a friend, perceiving him as perfectly good, not realizing his negative qualities, which we all have. But other times, the person will unquestionably hate this friend for something he did or did not, because at this other moment, the positive features of the friend no longer exist in the mind of the person with borderline disorder. In this way, a person unconsciously tries to protect himself from conflicting feelings. But this unhealthy protective mechanism leads to the opposite effect. Relationship problems deepen, and the sense of one's own identity becomes even more destabilized. So they often have intensive relationships that last short. It's all or nothing. People with borderline have difficulty maintaining relationships. But once attached to someone, it easily turns into overdependence. They are terrified of being abandoned. Therefore, they desperately try to prevent someone from abandoning them. They are constantly looking for clues that the other person does not love them. Even something as innocuous as loved one arriving home late from work or going away for the weekend may trigger intense fear. This recalls the sense of abandonment they felt as a child. They may beg, clean, start fight, and stalk loved ones. This behavior tends to have the opposite effect. In this way, they achieve exactly what they feared: abandonment. On the other hand, intimacy can scare them as well. Feeling suffocated, they push the other person away. Impulsivity, lack of stability, and self-control are main characteristics of a borderline. They may engage in harmful, sensation-seeking behaviors, like wasting money they cannot afford, risky sex, substance abuse, shoplifting, reckless driving, and binge eating. It may help them feel better in the moment when they are upset, but in the long run, their behavior hurts them and also people around them. Furthermore, they tend to sabotage themselves when they are about to reach a goal. For example, they may drop out of school just before graduation or ruin a promising relationship. Self-destructive behavior or suicidal manifestations are also very common among people with borderline. About 70% of patients with a severe form of borderline disorder attempt suicide. About 10% complete the act. Nearly all people with borderline have thoughts of suicide at some point. A significant proportion attempt suicide or engage in self-mutilation or self-harm. Common forms of self-harm include cutting and burning. People with borderline experience inappropriate, intense anger or difficulty controlling their anger. This characteristic of borderline manifests itself, for example, in regular tantrums, yelling, throwing things, persistent anger, or repeated fights. But this anger isn't always directed outwards. They may spend a lot of time feeling angry at themselves. Finally, people with borderline may struggle with suspicious thoughts about others' motives. When they are under stress, they can even lose touch with reality or dissociate. They may feel spacey or as if they are stepping outside of their own body. In this way, they become emotionally disconnected from themselves in stressful situations. For a long time, borderline was one of the least understood personality disorders. Moreover, it seemed virtually untreatable. In recent years, new insights have been developed about the treatment of borderline. While there is no definitive cure for borderline, it is absolutely treatable. Psychotherapy is a fundamental treatment approach for borderline personality disorder. Like with other personality disorders, treatment focuses on managing symptoms, reducing their intensity, and improving quality of life. This process can be difficult and takes time. Some may need hospitalization and additional pharmacotherapy at some point. There are different kinds of therapies which can be helpful. Schema-focused therapy, for example, can help to learn to change negative patterns from the past into healthy ones. There is also the so-called dialectical behavioral therapy, specially developed for borderline patients. It uses a skills-based approach to learn to manage emotions, tolerate distress, and improve relationships. Mentalization-based therapy emphasizes thinking before reacting. During this therapy, a person learns to recognize and understand their own and other people's mental states. Mindfulness and acceptance are important components of the therapy process. People learn to become aware of how they respond, think, and feel. Many patients may need EMDR as well to process traumas. I hope you found this information useful. If so, don't forget to like, share, and subscribe. Thank you for your attention. See you next time.